Thank you, Richard, and thank you all for being here today. I'm Tammy Moore. I'm in this capacity as the CEO of the ALS Society of Canada, and I'm joined by Ilayda Ulgenalp, who is the manager of our Advocacy and Stakeholder Relations program. And I really look at this talk as kind of a continuum, in an odd way, of some of the talks that we've given in the past when we've been talking about access to therapies. In this case, we're actually talking about the withdrawal of the access to a therapy or withdrawal from market of an access. What we're going to cover off today is actually a little bit about the process and some of the considerations that go into how we advocate, because it directly relates to some of the lessons learned and some of the things we'd like to see carried forward. We're going to talk about the case study itself, how did it come to be and what happened, and then what are the global implications as well. And we have a sneak peek at the very end of our slides of something a bit different as well. We think, too, that this is an important consideration, an important talk that we wanted to give today, because in our community, we're starting to see more therapies come forward. And if we take some of the lessons learned here, maybe we can build on them, and maybe we can avoid some of them for the future. So the first thing I'd like to talk about is actually the Canadian Consensus Framework for Ethical Collaboration. And this is an important tool that we came back to, and actually I really like how Leonard set us up so well to talk about this aspect. And it is, how do you maintain your independence when you're working with industry? How do you make sure that you've got the right kind of environment to be able to work in? And so the Canadian Consensus Framework is built out of work that has been done at the Asia Pacific Economic Consortium, and it's 26 different economies that have come together. And you'll find often there's industry guidelines and different things, but this is one that we work under. And it really takes into account the different groups. It takes patient organizations, healthcare practitioners, pharmaceutical, medical technology industries as well. And it's based upon three principles: patients first, collaboration and partnerships, and accountability. So when we look at it, patients first, obviously it's about the health and safety, and is this in the best interest of our patients? Collaborations, and the consideration of how do we inspire trust. The relationships must be transparent, and they must deliver greater benefits and services to our patients. And accountability, you know, when we look at it, it's a code of ethics. It's, again, how do we preserve high professional standards and uphold integrity? And we'd like to see this and be a part of this when it comes to helping the other members within the Alliance as well. And the Alliance has its own set of industry engagement guidelines. Again, quite similar, patients and caregivers first. The alignment of values and making sure that we're clearly defining what are those collaborations, how are they going to work together, and that transparency. And a lot of it comes down to that independence. Okay.
So before we dive in further, I just want to walk us through the brief history of the therapy. So in 2021, Amylyx filed for the regulatory review with Canada and the US. And in 2022, we actually saw that Canada was the first country to approve the therapy under the name ALBRIOZA, and the US followed suit shortly after and approved the therapy under the name RELYVRIO, two different names just to make things confusing for us. In Canada, it was approved under the Notice of Compliance with Conditions pathway, with the conditions depending on the outcome of the phase 3 clinical trials. And in the US, rather unconventionally, during the second advisory committee meeting, the FDA asked Amylyx to make a promise that should the phase 3 clinical trials do not show efficacy, that they would pull the therapy from the market. Amylyx did make that promise. However, it's a non-legally binding promise. Like I said, it was quite an unconventional one. In 2023, the European Medicines Agency adopted a negative opinion on the approval of the therapy based on their concerns around the phase 2 data. And in 2024, where earlier this year, Amylyx announced that the phase 3 clinical trials did not meet endpoints and that they would be removing the therapy from the market. So when Amylyx announced the results of their phase 3 trials, they were proactive in letting the community know that they would be discontinuing the therapy. In Canada, under the Notice of Compliance with Conditions pathway, that pathway accounts for situations like this, where if a therapy does not show efficacy in the phase 3 trials, meaning for this case they didn't meet their conditions of approval, Health Canada is able to remove the product from the market without depending on the company to do so. And a similar process exists with the FDA as well under the accelerated approval pathway. But the issue is that RELYVRIO was not accepted under the accelerated approval pathway. So in those situations, without that formalized process, the FDA rarely ever removes a product from an approved product from the market. Like I said earlier, Amylyx did make a promise to remove the therapy, and they ultimately did keep that promise, but it was a non-legally binding one, so it did create an interesting situation and overall led to a lot of lessons learned. So I'll turn over to Tammy to walk us through some of those.
So first, let's look at it in consideration of the consensus framework that we talked about. Did this follow what we were hoping? And the answer is yes in a lot of cases. We really felt like the company did work well. They talked and communicated and engaged stakeholders. They did put patients first. They were early looking at priority in the regulatory process to make sure that patients, clinicians, and the organizations were really well engaged. You know, another check mark for the collaborations and the partnerships, building those key relationships and then managing that communication so that we had an understanding of what was coming and we could have the appropriate understanding of what we would need to do next. And then accountability. When it comes to being able to look at the announcements and things like that, the fact that the company came forward very quickly, it really did work. When we looked at them and the consideration of discontinuing, you know, it was timely and accurate information. We've seen in other cases where that hasn't happened, and it is even more confusing for our community and something that we are concerned about. So we were pleased at the way this came forward. They were transparent and proactive, and in fact, that's what we heard from Health Canada, that the company took a very responsible approach to this, and they approached Health Canada to withdraw the drug from market versus Health Canada trying to come at them to get them to remove it from market. And that really, again, helped, and they were engaging us in the process of looking at what would that wind-down period look like. And then that engagement, as I've just mentioned, with Health Canada directly made a big difference. And I think we're always concerned about how does the ALS community get viewed in light of the the regulators, and what is that we're really setting up not even for these therapies, but for next therapies. And so by having that positive engagement right off the bat, it helps to ensure that we've got a good environment that's constructive. But where are there opportunities? And I think it's in the uncertainty regarding continued access. So although they said that they were going to be withdrawing the drug from market, and this was in the summer, it took until December for that drug to come through. And while we appreciated that time for people who did feel they were getting benefit, even if there was no clinical efficacy that was proven, it was important for them to have that time. And so just a bit more clarity around that would have been helpful. And then there's the unclear responsibility for ongoing cost. So at that point, it was who is responsible, because this drug had gone through the entire regulatory approval process, all the negotiations within our provincial healthcare systems and with insurance companies. And so who in that process, after they've decided that the drug, after the phase 3 trial came out, who should be paying for that cost? And we have to think about what is the cost of that to the overall system in this time frame as well. So there are some lessons learned. The first, and especially as we think about other therapies that might be coming through a similar pathway, you know, that early and ongoing engagement with stakeholders, it really is essential. It helps to build those relationships and understanding and establish a very clear set of expectations. Again, I would encourage you to look at some of the work that's been done by the Alliance with the industry guidelines, but as well there is a group, and we'll be sharing, I think, some information in the coming year around ethical guidelines, because they can really help to guide your organizations and set up a very clear set of framework that you can consider looking forward. Lesson number 2, you know, this is a tough one for our community, balancing speed with proven effectiveness. We all want therapies for our community, but I think it's safe to say we all want therapies that have efficacy associated with them. And so that's going to be that balance that we see when you have promising phase 2 data in a very small population. It's going to be a challenge because when we're having to wait for a phase 3 trial, we know all too well that our community does not have time to wait. But on the other hand, what is the cost to the community when they are taking a drug that may be safe but isn't efficacious? And what are the resources that are taken out? And it's not just the cost of that therapy, it's the clinics themselves, it's what the resources taken from people who may be taking the money out of their own homes and their own personal situations to pay for a drug that's not efficacious. And I think in the case of ALBRIOZA, we had the experience where for that therapy, it at least was in phase 3 trial at the time that they applied to Health Canada. Not all therapies necessarily are at that point if they're going to be applying, and what kind of extension of time frame does that take? And then lesson 3, transparency and consistent communication builds trust. And again, that's an important aspect and kind of builds off of lesson 1 in some ways too. It's setting up those really clear guidelines at the outset and then making sure that that continues through. And as organizations that are supporting our communities, we have to hold industry accountable too. It's great to have a press release that comes out and talks about all the great things. It's also important to have that press release that comes out when things didn't go as we expected and as planned. And making sure that we're holding industry to account on that and that we're working with them. And we can say that we've got some very effective relationships with our industry partners who've been very good partners in being able to do things. But it also is because we've built some of these relationships over time, and we must ensure that we don't get complacent in that. So in all, it's a checklist for ethical collaboration, making sure that we have the good guidelines in place, prioritizing early and transparent engagement with stakeholders, centering the needs and voices of our patients and caregivers in our advocacy efforts, balancing optimism with healthy skepticism, elevating outcomes of partnerships to ensure they align with your guidelines and advocacy goals, and maintaining accountability across all stakeholders.
So in terms of the key takeaways, regulators need to balance between providing early access to promising therapies that have no safety concerns and making sure that systems are in place to verify their long-term efficacy. Clear accountability frameworks need to be established to make sure that the costs of ineffective therapies are not passed on to the system, but are instead borne to the companies. So perhaps integrating that into their marketing authorization plan is an option. And in saying all this, we are sensitive as to how the Canadian market will be viewed for applications with phase 2 data and very small cohorts to demonstrate the efficacy. And I'm sure more learnings will uncover themselves as more therapies come through the pipeline. Tammy, I'll pass it back over to you for that exciting update.
Yes. So that kind of concluded the first part about the access. We did want to bring some late-breaking news, and you've heard about some of it earlier yesterday, and then also some of the great stuff that Carlos had to share in terms of good news and things to keep us going. So we did want to share just a brief update about a program that we've been working on for 2 years. And it really is an exciting aspect because it is a way that we were able to secure funding for the multidisciplinary clinics within Ontario, as well as for the services that ALS Canada provides directly to community. So our community leads who are out throughout the province of Ontario, and if you thought Canada was big, Ontario is a very big province, so we have people that are serving people in their homes. And then our equipment program as well. And so this was a significant win. The investment that we've received, that we're anticipating, will be over $13 million over the next 3 years. Devil's still in the details of how that funding, exactly the 3 years looks, but our ask was $6.6 million a year. And what we're anticipating is actually, it's the fiscal year of the government, so we're anticipating that by March 31st, we will have received the first tranche of almost $800,000, and then the subsequent 2 years will have the rest of the funding. Again, why we didn't bring a full presentation is that we think that there will be more updates and learnings to go along with it. But what's important about this program and what we really wanted to highlight was that this was based upon clinical guidelines or best practice recommendations that we worked with the clinicians to produce several years ago. And it was from that we were able to establish what every clinic should have, as well as the services that are provided by our society. And we were able to utilize that to come up with a per patient requirement and take that to our government with a dollar ask associated with it. And the way we articulated the problem was that government, you didn't understand there was an issue before because, frankly, the costs have been borne through residual hospital operating budgets and philanthropy. And it's time that that changes. It is unsustainable and inappropriate because, in essence, what we're providing is healthcare resources and they need to be provided for as such. And it was the strength of the collaboration that got this through. So it was one principal clinic that brought it forward to us, and we worked together on it and then rolled it out to the other clinics for sign-on. And we had to absolutely be lockstep together to be able to get this forward. And we had to draw some hard lines in the sand, and we were looking at some very significant changes to our equipment program to really draw that line in the sand. But what we started to say was, if nothing changes, nothing changes. And so why would the government pay for something that they were already getting for free? So this is where we had to make a change and we had to put a definitive time frame to it. Otherwise, they wouldn't have made the change. And then working with the clinic, we had to be able to be completely together. So there was no opportunity for us to divide. And at times it was like, we'll just take something, let's go. It's like, no, if they divide us, they will conquer us. We need to be together. So we were very excited to be able to have this funding. It really validates the services that we provide through our society. It really makes it that the government sees that value and is willing to invest in it. And it really brought together the clinics and ALS Canada in a very strong way. So this is a kind of advocacy that I think can be a model of how we can collaborate together to be able to solve some bigger problems. So we were happy and excited to be able to share this with you. We know that there will be more updates to come, and we would love to talk to you about it in the future.
So thank you so much, Tammy and Ilayda. So very inspiring questions. Over there, Norm.
Thank you. I'm Norman McIsaac. Congratulations to ALS Canada on your big win in Ontario. I would like to give the patient perspective on ALBRIOZA. One thing I noticed in several presentations is we talk a lot about patient involvement. And I worked for all my career in international cooperation. And we use a term called participatory development. And I realized after I wrote the manual for the Canadian government that in fact we were making excuses for top-down systems. And we were controlling the process and projects, but we had to involve the participants. In my career, I learned that this is a backwards approach. We should be supporting leadership from the patient community. And happily, we've been talking about this for nearly 10 years, Tammy. And that's how the Kali was born, to form patient leaders and equip patient leaders to lead. So, and that was inspired by the Curly of Niels. I think I remember I started a parliamentary petition at that time, and everybody told me to wait. It wasn't time. And as a patient, I'm impatient. And so I went ahead and harnessed, created links with patient groups in their societies across the country. And together, we managed to get 25,000 signatures from every province and every territory in Canada. And the reason, and I thank ALS Canada for supporting that. But I think we have to be careful in the way we frame things, because we should not only control the process and involve patients, we should allow spaces and training for patient leaders. And ALS Canada has successfully done that. But the patients have one advantage. Our lives are on the line, and we are impatient. So keep it in mind, all of you. Please don't frame it as patient engagement. Frame it as providing space and tools for patients to act as effective advocates. Thank you.
Thank you, Norm. And that is a very important aspect. Norm was referencing the Canadian ALS Learning Institute built off of the Curly that really has helped to create incredible ambassadors, and we have a number of them in the room today, making sure that the people in our community are well informed and well equipped to be able to participate in even things like Health Canada. The very first patient listening session they did was with the ALS community, and it was largely a number of community ambassadors who are engaged in that. Norm's also part of our advocacy committee, our national advocacy committee. And when it came to the success of the provincial program, it was really our patient community that pushed it over the line. Ilayda happened to get the text phone number for our premier, who she shared with a couple of our patient community, and they were the ones that were texting the premier. And the premier responded. Not only in text, but he actually called one of the families. He spent 10 minutes with them on the phone and said, I can't promise you anything, we'll see what we can do. And he did not promise he would call them back, but he did the very next day because he was so moved by their story, and he told them that we had the money. Now, our premier says a lot of things, so we didn't trust it right out of the gate. But what we heard was, it was the stories, it was the real life realities of it. And we have people living with ALS who are on our advisory council that really help to make sure that our work is well informed and that we're bringing forward the priorities of our community. But thank you for framing it that way, Norm. I appreciate it.
So thank you so much. I think we have to move on.